Hi, welcome to Dementia Action Alliance and our dementia discussions. Today I am honored to have with us Dr. Edward Shaw. Dr. Shaw, MD, MA, is duly trained as a physician and mental health counselor. He was a primary care partner for his wife, Rebecca, who was diagnosed with early onset Alzheimer's disease in 2008 at the age of 53 and passed away in 2016 after a 9-year journey. He founded and directs the memory counseling program at Wake Forest Baptist Health in Winston-Salem, North Carolina. This program provides counseling and resources for individuals, couples, and families affected by dementia. He's the author of 2 books, Keeping Love Alive as Memory Fades, which describes his personal story of caring for Rebecca, as well as how to use Dr. Gray Chapman's 5 love languages to maintain a strong emotional connection for a person living with dementia. His newest book, The Dementia Care Partners Workbook, is a support group manual and self-study guide for dementia care partners, providing understanding, education, and hope for the long journey of dementia caregiving. Dr. Shaw, thank you so much for being with us today. Really appreciate having you here.
Thanks, Laurie, and I really appreciate the invitation to share about this topic of preparing for a doctor's visit. So having conducted many doctor visits over the years, I put together some slides that I believe you'll be showing as I speak that will talk about the different topics related to how do I prepare and have the most successful visit with my doctor possible.
Awesome. We're excited about hearing this because, many of us here have been diagnosed with some form of dementia, or our care partners might be here as well. And it's so hard to know, what do I really need? What's going to best help the doctor to help me?
Yes, and so that's why I've tried to think about this both from the perspective of the medical provider, doctor, nurse practitioner, physician assistant, many different providers, as well as having been to many doctor's visits with my late wife. What is it that we did to get the most out of that visit? So, shall we jump in?
Absolutely, thank you.
So I want to start with just talking about who should come to the visit. Well, obviously, it should be the person who's living with dementia. I think it's very helpful to have the primary care partner. Often there's many different care partners involved, but whoever would be identified, either the spouse or maybe one of the adult children as the primary care partner. And if you have a paid caregiver that's part of the caregiving team, and they're there on a regular basis, it may be helpful for them to come as well. In terms of what to bring, it's always important to bring those insurance cards and Medicare card. Those are often asked for at check-in. I think something really important is to bring at least a list of medications, and it's even better to bring all of the medication bottles in a bag. Sometimes if you're at the point where taking pills becomes difficult, it's helpful for the doctor to see the medicine, to hold it in their hand and to look at it to see if that medication can be crushed and put in food rather than having to swallow a pill. And then there are legal documents that may be helpful, like the durable power of attorney or a healthcare power of attorney. Sometimes those documents need to be accessed. And if somebody's towards the end of their journey, even something like the living will or do not resuscitate order, or what's called the POLST, P-O-L-S-T, the physician order for life-sustaining treatment. Those are documents that ask particular questions for certain end-of-life decisions that have to be made. And lastly, but certainly not least, is what are the questions you have for your medical provider? What are the things you want to make sure and have answered by the end of that 20 or 30 or 40 minutes? So we'll go to the next slide, and these next several slides are going to focus on what does the doctor want to know? What does the medical provider want to know about you when you come to the visit? Well, primarily they want to know what are the symptoms that you're experiencing. Have you had any changes in those symptoms? Have you had any challenges related to the symptoms that you're having? And are there any other concerns that you have? So when I think about seeing somebody who's living with dementia as a doctor, I want to know about their cognitive function, their physical function, and just how they're managing on a day-to-day basis. So let's begin by talking about what are the areas of cognitive function that the provider will want to know about. So cognitive function is divided into 5 different things, as you see on this slide. Your cognitive function includes your ability to pay attention and to concentrate and focus. It includes your short-term and your long-term memory function. And then this thing called executive function, your ability to plan, problem solve, and multitask. The 4th is your language ability, the ability to understand what you hear and also to get out the words that you want to get out. And the 5th cognitive function is the hardest one to describe. It's your spatial function or visual spatial function. It's what allows you to sort of navigate in 3-dimensional space, going up and down steps and curbs safely, and your ability to drive, to stay in the middle of your lane, slow down appropriately when you come to a stop sign or a stoplight, things like that. So those are the cognitive functions. Now, if we go to the next slide, some of the other things that are related to cognitive function, but are not cognitive function per se, are these 3 things: personality, mood, and orientation. So your personality includes things like, are you more of an introvert or an extrovert? Are you more socially engaged, or do you prefer to be more to yourself? So personality is an important part of who you are. Have you had any changes in your personality? That's something that the doctor would want to know. Your mood, things like, am I feeling sad or depressed? Or do I feel anxious or worried or fearful? Or do I feel safe at home where I am? Those are also important things. And then this function called orientation, knowing the day and the date and the time and the year. Sometimes that can be a challenge for people who are living with dementia. So the doctor might want to know about those things.
I have a question, if you don't mind here, Dr. Shaw, on sadness, depression, anxiety, worry, and fear. This is where I would imagine it's important to have a care partner with us, because if I've always been a person that was depressed, how relevant is it for the doctor to know this is a personality change versus this is the way I've always been?
Yes, thanks for asking that question. So it reminds me that it is really important to have that primary care partner there, because sometimes the person living with dementia is going to have a different perspective on their mood than their primary care partner. So when I think about sadness versus depression, sadness is a normal emotion that we all feel in reaction to life events. Depression is different. Depression is where you don't want to get out of bed. You just sleep all day. You don't enjoy any of your usual activities like eating or being with maybe the kids or the grandkids. And I think that both of those perspectives are really important, because a person who's living with dementia may say, well, I'm just experiencing some bad days and, I'll pull out of it. Whereas maybe their adult daughter or son would say, but Mom, you haven't really gotten out of bed or wanted to see your friends or even the grandkids for a week. That would really tip me off that maybe there's more of a depressive situation going on. and then we would talk about how to manage that differently. So does that answer your question?
Absolutely. Thank you very much. And I agree with you. I think there are times that my husband realizes changes in me that I didn't realize at all. So I see where that would be so important.
Mm-hmm. And I think worry would be another example, worry versus anxiety. It's normal to feel anxious about certain things that happen in our life. But if we become so worried that that's all we think about, that would be a level of worry that we would need to talk about how to manage. So yeah, appreciate that. I mentioned that on the next slide, I mentioned earlier that talking about how we function day to day is a really important part of assessing somebody who's living with dementia. And so the way we divide, or the way I think about this, is the framework of these things called activities of daily living. So on this slide, you see I have two categories. One is called instrumental activities of daily living. These are the activities of daily living that require our executive functioning, that planning, problem solving, multitasking ability to be intact. So things like driving, preparing a list for the grocery store and shopping at the store for that list, preparing a meal, cooking the meal, and serving it, taking medications properly, getting the bills paid, cleaning house, doing laundry, and then a category I call using electronics, being able to use your cell phone or get on your computer and do email. You know, how is it going doing those things? Are those things coming more easily, or are you finding more challenges with some of those instrumental activities of daily living? And then for some people living with dementia, they may be challenged in the more basic activities of daily living. So getting dressed, being able to eat, going to the bathroom and bathroom hygiene. Are there any struggles with incontinence, either urinary incontinence or bowel incontinence? What about bathing and showering? Is there help needed there? And last is transferring. You know, any difficulties getting up and down from a chair, or maybe in and out of bed, in and out of the car, just all the kind of different ways that we transfer from here to there in a day. So these are the ways that I like to think about functional activity, because it helps me give a sense of how the person is doing on a day-to-day basis. If we go to the next slide, there are some other questions that I like to routinely ask. So the first is about the person's stability with their gait or their walking. Have there been any falls? You know, falls are a big deal for anybody who's getting less young, especially somebody who's living with dementia. We want to make sure we do everything possible to avoid a fall. And that's why checking in on this particular thing is really important. For some people living with dementia, especially in the later stages, have there been any medical things that have popped up? The most common medical changes that occur in people living with dementia would be things like a urinary tract infection, or it could be a respiratory infection, or if somebody's not really as mobile as they used to be, something like a blood clot in the leg where one foot or ankle would be more swollen than the other. So these are important things to check in about, especially if somebody has experienced a fairly sudden change in just their personality or their mood. It may be related to an underlying infection and not have anything at all to do with their dementia. So any change in medical status is really important to share with the doctor. Laurie, as we talked about a little earlier, sleep is a really important thing. Getting a good night's sleep is important for all of us, but we know for any of us, whether we have dementia or not, if we didn't get a good night's sleep, our brain is not going to work as well. So are you having trouble falling asleep or staying asleep or getting up too early? You have sleep apnea? Are you wearing that device, the CPAP device, or are you having any difficulties with maybe mixing up days and nights? Sometimes that happens. So,
Dr. Shaw, I know that in the group of over 50 of us living with dementia that get together on chats occasionally, well, occasionally once a week, sleep tends to be something that we start having issues with fairly early, where our sleep habits are changing. And boy, that seems to be something we all deal with. But I have a question regarding that. I know that there are a number of devices out there, Fitbit, Apple Watch, etc., where it monitors your heart rate, your sleep patterns, and lots of other good kinds of stuff. How many steps you take, so your exercise as well. As a physician, how important would it be for you to have that information?
Yeah, that's a great question. These technologies have been really helpful for medical providers, especially in people who are maybe struggling with changes in their day-night cycle, or struggling with insomnia and difficulty sleeping, or maybe for people where we're encouraging activity like walking, but we're not sure how much walking the person is doing. These new technologies now allow you to monitor just how many steps you're taking in a day, or how much you're up and down, how much you're, in bed or resting versus active. And that can be helpful for the doctor to know some of those different things just about the person's function that you wouldn't have without that technology. So, Laurie, I'll talk just on the last bullet point on this slide is anything else that you think is important for your medical provider to know is important for you to share with them. So I have notes for myself. Let's say you have vascular dementia. You might want to report to your doctor, are you having any symptoms of TIAs or mini strokes or any other stroke-like symptoms? For people living with frontotemporal dementia, have there been any changes in behavioral expressions? Because often that can be a cue that there's a change in something going on. And for people living with Lewy body dementia, there are other things I haven't mentioned, things like tremor or maybe muscle rigidity, muscle stiffness. Has that been any more of a challenge? Have there been any delusions or hallucinations that you've been challenged with? And how has sleep behavior been? The REM sleep disorder, or having more vivid dreams, is that something that's been going on? So sometimes for different types of dementia, other symptoms might be helpful to talk with the doctor about. But really getting back to what I said earlier, what has changed? What's challenging? What are the things that either you as the person living with dementia or as care partner, what are the things that you want the doctor to know? So we'll transition into the next slide, which is what happens in that doctor's visit. So that visit may be 20 or 30 minutes, perhaps it's 40, 45 minutes or an hour. However long it is, the time seems to go really fast for everybody. And I just thought it would be helpful to talk about what are the things that I like to make sure and have happen during a visit. So the first thing is the medical history. That's a fancy terminology for just talking with the person living with dementia and their care partner. Sometimes I like to talk to them separately. Often I'll take a few minutes to talk separately with each person, and then I'll bring them together and say, all right, I heard some different things. That's okay. Sometimes we disagree, but I just want to clarify from both of you, what did you mean by, for instance, the example we gave earlier, well, it sounds like you've been staying in bed for the last week and not wanting to get up for meals or go see the kids. It sounds like maybe you're having some depression. That's the kind of thing where I think talking with people separately and then together can be really helpful. So that talk time is really important. It's always important to go over medications. Want to just make sure maybe that something new has been started with a primary care doctor. And it's just always good to assess where medications are. My own philosophy is the least amount of medication somebody living with dementia is taking, the best. And so it may be, for instance, if someone is having some challenging behavior expressions and there are medications being used, in our geriatrics department, every 3 to 6 months, we ask the question, can we go off those medications? Can the person go off those medications? Maybe it was just a transient phase that where there were challenges there. So the meds are important. I like to have a time to focus on the care partner, the primary care partner, just to address their level of challenge that they may be feeling and maybe how they're doing in terms of their own sadness or anxiety, and are they getting the support that they need. So we're fortunate at Wake Forest, we have a counseling center that we can I direct and we partner with, and we have counselors that can address some of these care partner changes and challenges that may go with the journey. A physical exam is an important part, even a quick physical exam. There's just something about the laying on of hands. When you touch the person living with dementia, check the heart and lungs and the belly, and just make sure that everything is okay. And then a focused neurological exam if there are things that need to be checked. For people, especially in the earlier middle part of the journey, I like to have an assessment of the cognitive function. So often we'll do one of the brief assessments, either the mini mental status exam or the Montreal cognitive assessment. This is a 5 or 10 minute sort of paper and pencil test that gives an idea of overall cognitive function. And I'm sure many people who are listening are familiar with these instruments. The doctor may want to order other things, blood tests, urine culture, depending on what the symptoms are, and they'll talk about the need for those things. And then there will be a wrap up, kind of a summary of, well, here's where I think we are. I think most people benefit from knowing where they're headed. So these are the things we might anticipate on the journey in the weeks or months ahead, and then just talk about when's a good time to come back. So, Laurie, that is a whirlwind tour of a doctor's visit. I know that was lots of information. In my new book, the cover of which is on the very last slide, called the Dementia Care Partners Workbook. This is a book that I just finished writing, and it came out a couple of weeks ago. Really talks about everything that a person living with dementia would experience from the beginning of their journey all the way through the later parts of the journey, and all the things that their care partner may be faced with, and has just tons of information in a easy to read format. It has spaces for journaling, both for the care partner and for the person living with dementia. And it serves as a support group manual and a self-study guide for those who are caring for someone on the journey. So that's available at Amazon or through my publisher, Companion Press, at the website that's shown here on the slide. And it does have, for those people who want to lead support groups, there is an accompanying leader's manual that's available too. So Laurie, that's... Sure.
Thank you so much. You have certainly shared with us a lot of information. And I truly appreciate you giving your time and being with us. And I'm sure that after we finish airing this podcast and then have our discussion, that there's going to be lots more questions. But for now, I'm going to need to stop asking you some, although I have a few more, so I'll be on to ask you more questions that day. But thank you so much for being with us. For those of our listeners watching this podcast, I encourage you to go to Dementia Action Alliance, which is daanow.org, and go under podcast. We have quite a few podcasts that may help you with your dementia journey. So thank you all for being here and for listening. And Dr. Shaw, thank you so much for your time today.
Thank you.
Connecting our lives to help us survive, so we live our time to the fullest we can.